World Elder Abuse a Day Conference, which is held June 15th every year. The National Center on Elder Abuse reports that approximately 1 in 6 older adults are affected by elder abuse every year. So this year's theme is focused on learning about connecting older adults to community resources and services as a way to prevent abuse, neglect, and exploitation. Last year, the Division of Aging and Adult Services completed a statewide needs assessment, and results from that needs assessment indicated that many vulnerable adults and service professionals are generally unaware of available services. And some of the service barriers include lack of guidance and information, long wait lists, availability, in particular in rural areas, and accessibility to include access to internet, transportation, and often language barriers. So today's event is going to focus on how can we get people connected to the available resources throughout the state. We would first like to start off by thanking our participating partners, and starting with the Utah Commission on Aging, and thank Rob for hosting this event. Also AARP Utah, Senior Expo, the Alzheimer's Association, the Utah Area Agency on Aging, and the Department of Health and Human Services, Division of Aging and Adult Services. Today's format is going to be different service providers throughout the state that offer services to older adults. And we're going to have 3 presenters at a time present, and then after each grouping of presenters, we will have question and answer periods. So please put your questions in the chat, and after each grouping of presenters, we will then have a 10-minute period to answer any questions that are that come up in the chat. Our agencies that are presenting today are going to be the Division of Aging and Adult Services, the Area Agencies on Aging, the Utah Commission on Aging, the Alzheimer's Association, AARP, Senior Blue Book, and 211. And so we are going to go ahead and get started. We are going to start off with Nels Holmgren, who is the Division Director of the Division of Aging and Adult Services, followed by Rochelle and Amy, who are Executive Directors of 2 of our area agencies on aging in the state, and then Rob Hentz with the Utah Commission on Aging, after which we'll have a Q&A session. Nels, turn it over to you.
Thank you, Tracy, and it is wonderful to see so many of you here today. This is certainly a topic that is deserving of an annual effort and an ongoing effort as we work as partners to keep our older adults across the state healthy, safe, and independent, and allow them to continue to do those things which they want to do in a way that is free for them to do it. So appreciate all of you being here. Huge thanks to Tracy for her quarterbacking of this event every year, and for Rob Hentz and other partners who have worked to make this event. Amazingly, the fifth year, it's been great, and time flies. So thank you to all of you for your efforts and for your concern on these matters. I wanted to take a moment this morning and share with you some work that's been going on. Many of you are familiar with this, but others may not be as familiar, and that is the governor's WISE initiative. He started discussing this last summer and into the fall about making aging issues a pillar of his second administration. And then in December of last year, when he released his budget proposal for the 2025 legislative session, he included in that process the WISE Aging Initiative. And WISE, as always, with all good government things, we need acronyms, and WISE is an acronym here as well for Wealth, Independence, Security, and Engagement. And these various areas of this initiative are really designed to allow our older Utahns to remain healthy, safe, independent, and engaged in the community. Obviously, today, as we discuss elder abuse issues and these concepts, that fits very clearly into the security area of this initiative, but there are a lot of areas across this spectrum where security and fraud prevention and independence certainly play a role in the security and safety of older Utahns. As part of this initiative, we conducted a series of listening sessions around the state and trying to hit sort of strategically areas that would pull in as many people as possible from St. George to Logan. Obviously, we were not able to be in every community, which we regret. However, we feel like we were able to strategically hit many areas where there are concentrations of not only older adults, but also of caregivers, providers, local policymakers and decision makers, agencies that all work in this effort to keep our older Utahns safe, healthy, and independent. We received a number of we did studies on data impacting seniors and received feedback on that. There are some stats there, but there are all kinds of issues that were brought up as part of this process and working to make sure that we're understanding, whoops, just dropped me out. It moves in a mysterious way, this technology, but understanding the issues facing older Utahns, but also their desires and the things that are on their minds. As part of that, we received a lot of feedback and some really consistent themes that came out across all of these sessions with regard to these 4 quadrants. The area that we're discussing today in terms of security, keeping seniors safe, providing mental health services, there was a lot of discussion of scam and financial exploitation avoidance and how to connect seniors to resources when they have needs, and also preventative resources to make sure that some of these issues that we'll be discussing today don't become larger issues going forward. So what's next from this? We've completed the in-person listening sessions, but we are still collecting feedback. There is a video that is being prepared next week that'll be posted online, kind of going through the same information, but also providing a channel there, or several channels, for people to continue to provide feedback through electronic means, through mail, and through being able to contact us directly. Based on that, we are in the process of developing 4 working groups that will be doing deep dives into these various topics using the synthesized feedback that we received from the listening sessions and from the rest of the feedback that we've received. They'll be working to come up with strategies for developing a 10-year plan on aging for the governor. Now, there are a lot of great plans out there. Here at the division, we have a 4-year plan that we work with the federal government on. The area agencies on aging have tremendous and detailed plans. The multi-sector plan on aging, there's been a ton of work and emphasis on that. This 10-year plan that the governor has commissioned from us is not designed to supplant or to replace any of those plans, but rather to bring them together to make sure that we can synthesize a lot of these great ideas out there and kind of bring it into a more of a holistic concept to be sure that the state is aware of the issues facing our aging network and looking for opportunities to develop benchmarks and goals to move this work along. So as you see there, the work groups are going to be starting, they'll be working through the winter of this year. A draft of that plan we anticipate in essentially a year from now will be put out, and then we'll spend the spring of 2026 receiving feedback with the plan of publishing that next summer. So we're not at the beginning and not at the end. We're kind of at the end of the beginning, and we're moving forward from that. So this information is going out, and this will be posted on our website. But there are opportunities to visit and look at the information that's already been provided, to continue to provide feedback, and also we've had people ask about being able to send written correspondence, and we have an option there for that as well. So we're certainly moving forward, but we are not done collecting feedback and still want to hear from people. So again, this has been a great effort. We appreciate the governor and his commitment to these issues, and a real understanding of the need to focus on older Utahns and maintaining their security and independence and health. We appreciate all those who have participated so far in this process, and preemptively appreciate those of you who may be called upon to serve in these work groups and provide additional feedback and additional input on this plan as it develops. So this has been an exciting process, and we're looking forward to a lot more. Thank you all so much again for your attendance today, and I will turn it over, I believe, to Rochelle and Amy are next.
Thank you, Nels. Hi, my name's Rochelle. I work in the Davis County area, and I am co-presenting with Amy from the Tooele area. Let me get my slides up. Okay, perfect. I think I'm up and running here. Today we're going to talk about the Area Agencies on Aging, also known as the AAAs for short. So, as many of you know, we have a growing population of older adults. Wanted to highlight that here. So in 2019, 16% of all Americans, or 54.1 million individuals, are over the age of 65. It's estimated that 10,000 individuals are turning 65 each day. By 2040, an estimated almost 81 million older adults will reside in the U.S. That is 1 in 5 Americans. Bringing that specific for Davis County, our older adult population will actually double by 2040. Bringing that just to Utah, Utah data suggests that individuals over the age of 65, or the population of individuals over the age of 65, will double by 2060. So wanted to start at the foundation. Where does AAAs come from? How did that come about? So starting with the foundations, we have to start with the Older American Act, which was originally enacted in 1965. So it was the first federal legislation devoted exclusively to addressing the needs and challenges of older Americans. And over time, it has had many reauthorizations and expansions. The mission of the Older Adult Act is to ensure that older adults can live with dignity and independence in their homes and community by providing a network of federal, state, and local services and support. So again, trying to emphasize what an area agency on aging is. So as part of this Older American Act, in 1973, area agencies on aging were formally established as the on-the-ground organizations charged with serving older adults. As mentioned, our programs are funded by federal and state and local dollars. That also includes contributions from our older adults. The mission of Areas on Agency is to enhance the health and well-being of adults age 60 and older by promoting safety, health, and independence. We achieve these through coordinated systems of services that include education, assistance, referral, nutrition, and socialization. So we wanted to share a video, which we have to thank Rob, our next presenter with the Utah Commission on Aging, that highlights the services of AAAs. I'm gonna go ahead and play that video.
I'm Rob Entz with the Utah Commission on Aging. Area agencies on aging administer a wide variety of home and community-based services for older Utah residents. These agencies are primarily responsible for a geographic area, also known as a planning and service area, a PSA, that is usually a single county or a multi-county district. They coordinate and offer services to ensure that older adults have the support required to remain independent. Let me introduce you to Utah's agency leaders.
I'm Mary Lucero with the Mountain Land Region. Aging Services offers caregiver support groups, classes, respite care programs, and can connect you with local volunteer opportunities to help you give back to your community.
I am Rochelle Blackham from the Davis County area. Aging Services can help coordinate transportation to critical medical and other essential appointments.
I'm Amy Hofteser from the Tooele County area. Aging Services manages community senior centers where individuals can engage in a variety of activities, receive meals, and get access to the Meals on Wheels program.
I'm Carrie Schonlaw from the 5-county area. Aging Services offers friendly visiting and telephone reassurance calls to make sure you are safe and connected socially.
Hi, I'm Paul Leggett from Salt Lake County Aging and Adult Services. Aging Services provides information and referral services, including screening and assistance in enrolling in public benefits and helping veterans connect to benefit programs.
I'm Doug Kirkham from the 6-county area. Your Aging Services agency advocates for your safety and rights through education on elder abuse and fraud.
I'm Shauna with Southeastern Utah area. Aging Services can assist you with programs for older adults with the need for in-home services, which includes case management or care coordination.
I'm Cindy Roop from the Uinta County area. Aging Services provides health insurance counseling to help you understand and navigate choices related to Medicare and related health coverage.
I'm Tammy Gallegos from the San Juan County area. Aging Services provides education for healthy living, nutrition, and free health screenings.
I'm Michelle Summerall from the Uinta Basin area. Aging Services can help connect you to the vital support groups, including caregiver, grief, and loss, and Alzheimer's.
I'm Nobu Izuka from Weber Morgan area. Aging Services provides wellness programs to help you maintain a healthy lifestyle, including nutrition, fall prevention, exercise and strength training, Tai Chi, and other activities.
I'm Carolyn Reed from Bear River area. The Aging Services has an ombudsman program to protect our elderly that are living in long-term care, assisted living, and skilled nursing facilities.
For more information about services in your area, please visit your agency by clicking on the map or link to your Aging Services website. We look forward to serving you.
Hopefully you enjoyed that video. What I'd like to say is we also have a one-page handout where it does show this area on agency map and has all of our contact information that hopefully Terry or Rob can share at the end of this presentation. But this map gives you an idea of where the area agency regions are. And at this time, I'm going to turn the time over to Amy to talk a little bit more about our services.
Hi, I'm Amy Hofteser. I'm the Director of Aging Services for Tooele County, like you saw in the video. And AAAs are the go-to experts on aging in their local areas. While every AAA may offer slightly different services depending on their community's needs, they all focus on connecting older adults and caregivers with the right resources. So let's walk through a few of the main programs and services AAAs typically provide. Caregiver support's a big one. Many family members are providing care without pay, and it can be overwhelming. So AAAs offer support groups, care coordination, and even respite care so caregivers can get a much needed break. There's also training and education, especially around dementia care and stress management, plus help accessing supplies, assistive devices, or getting connected to trusted resources like the Alzheimer's Association. Then we have the Long-Term Care Ombudsman Program. This role is all about advocacy, making sure people in long-term care facilities are treated with dignity and respect. Ombudsmen help resolve concerns about the care people are receiving in long-term care facilities. Ombudsmen work to educate residents and families on their rights, and ombudsmen support facility staff in best practices. Legal services are also available too, especially for older adults at risk. AAAs often work with Utah Legal Services to make sure older adults have access to the legal guidance they need. Next, we have a few Medicare-related programs. Excuse me. SHIP, the State Health Insurance Assistance Program, they offer one-on-one help to navigate Medicare and other health-related coverage. And SMP is the Senior Medicare Patrol, and this helps older adults avoid fraud and errors in their Medicare billing because unfortunately scams are all too common. Next is nutrition services. These are another essential piece. This includes congregate meals where people come together to eat, carry-out options, and home-delivered meals, what many know as Meals on Wheels, which also includes a daily safety check. There's also nutrition education and nutrition counseling built in. Now for home and community-based services or in-home services. These are designed to help older adults remain independent in their homes instead of moving into a facility. They include case management and help with chores, personal care, homemaking, companionship, and more. There are several specific programs here, like the Medicaid Aging Waiver, the New Choices Waiver, the Alternatives Program, and Veteran-Directed Care. And each of these programs has specific eligibility requirements. So if you're interested in any of these, you'd want to go directly to your AAA. Many, but not all of these, focus on low-income adults who are at risk for entering facility care prematurely. And finally, support services. This includes health promotion and evidence-based wellness programs, transportation coordination for essential needs like medical appointments, and senior centers, which are really the heart of community life for many older adults. Senior centers offer meals, social connections, volunteer opportunities, and engaging activities like art, computers, and recreation. Next slide, please. So in short, AAAs serve as a vital hub, making sure older adults and their caregivers have access to the support, services, and community connections they need to thrive. Next slide. Aging, so cool, everyone's doing it. I want to give credit to MAG for coming up with this catchphrase and making it popular. At last year's centenarian event, by the end of the event, many people were wearing this button with this catchphrase on it, even Governor Cox. I know I wear my button proudly every day on my ID badge. I have it here. Aging is so cool. So the next slide just is an opportunity for questions and our contact information. And I know we're going to be coming back with Tracy for a Q&A. So thank you.
Thanks, everyone.
So I'm Rob Entz, Executive Director of the Utah Commission on Aging. And I too want to thank Mag for that great tagline. Aging is very cool. And we should all be very proud of that, recognizing that there are many challenges and obstacles that we encounter through life generally, but there are also incredible opportunities that come with the aging journey. And that is part of the mission of the Commission on Aging, is to make absolutely sure that we are exploring and preparing for the future to address those challenges as well as take advantage of the many opportunities. The Commission was originally formed in 2005 and has now exists for the past 20 years, working on a variety of projects, but the last 10 years specifically to build very strong coalitions. And the statutory requirements, there are 24 appointed members, but then there's a very, very broad community stakeholder group that represents the interests, and you're hearing from many of them today, that work collaboratively. And the commission is situated kind of at the center of public policy work, research and academia, the community resources, many of them you're hearing today, and to provide a communications hub that will connect these various groups and to try and keep everyone well informed of what each other is doing. The other thing that's unique about the commission is that it really is intended to cover the spectrum of aging. So the moment a person becomes an adult at age 18, there are things that individuals start to do and decisions made that impact the rest of their lives, whether it's financial health, physical health, even concepts like advanced directives and so on. These are all issues that kick in at adulthood. And the better we do in our younger adulthood, the better prepared we generally will be for our older adulthood. And a lot of the services and things that you hear about today are really focused on making sure we have access to resources and know where boots on the ground are really there to help and assist people. There are a lot of issues that we encounter in our lifetime. And sometimes they come one at a time, sometimes they come in batches, but you can be assured that you and your loved ones will encounter some of these challenges throughout. And so this conversation is very critical to know where to go. And the important thing is that we all ascribe to the no wrong door approach, meaning that every one of these agencies has enough connection with each other that they can help direct you to the place that you need to go to find those resources in the most effective way possible. Ultimately, the commission's goal is to make sure that in our hub that we have, if you can't figure out where to go, if you just are really stuck on a particular issue and resources, then the Commission on Aging is supposed to be that digital navigator through its virtual resource center that will help you connect and help triage your situation and help you connect with the resources that you need. At the center of this, which we'll talk about in just a moment, is the Utah Master Plan for Aging, which was in concept around for a long time, but really codified starting in 2023 with a mandate from the legislature to create this vision in 10-year increments into the future of what we need to do to prepare as agencies, as well as a state and municipalities, for the changing demographics and challenges that will hit our workforce, our healthcare services, and all of the things that are represented by these organizations today. And there are several channels we've developed to help make that happen. So we're going to look for a moment at the website. We have future projects that are in play or designed to be in play when funding becomes available. But we invite individuals to follow us on Facebook, look at the YouTube channel, which this recording of this event will be there in a couple of days, but become familiar with the Virtual Resource Center and to add your thoughts of how we can improve that to make it more user-friendly. So we're going to take a dip right now into this virtual resource center, which really grew dramatically during the COVID years as we all became very dependent upon virtual connections to survive. And one of the major goals of the master plan, in addition to focusing on key areas like finance and health and age-friendly communities and caregiving and self-empowerment and making decisions for yourself throughout your life, was the idea of embracing technology. And our goal, and I think it's mutual amongst all these organizations, is to make sure that we work together to make that older adults have the opportunity to engage virtually, to take advantage of the resources, to take advantage of so many different opportunities, experiences, and to follow events and activities that they can become engaged in person or online. But most importantly, that they're connected, that they have affordable access, that they have the equipment to be able to do that, and ultimately that they know how to use it and to use it safely, which is very, very critical. So just a quick walk around on the commission side for those of you who may not have had an opportunity to do that. I'm assuming you can see that's right. You can see the commission site. Thank you. This is where we track our quarterly meeting efforts under the commission home. We also have an area here that's important to note that we have specialists who have all raised their hands and on particular topics that you can sort here are available to you in your organization to give presentations around their expertise and to help mentor other groups. They're not there to do the work for you, but they're there to teach and help people understand topical interests. You've already heard from Aging Services. Division of Aging Adult Services, as well as the AAAs, are so critical to our state as they are at the handoff of so many important things. But they can also get overwhelmed with lots of requests. And so we all have a responsibility to advocate to make sure we have resources available for Aging Services. And here, as well as the video you just saw, we also connect people to DAAS as well here. And then, of course, the interactive map that was referred to can connect people to county services. And this gives a description of where each is. And there's a similar one that you just saw in the AAAs. We also have a direct link to all of the sites as well on this page. We hope to have always a very current thesaurus, if you will, of older adult issues that are of interest to people. And this can be pointed to at several spots on the website. But the idea behind this is to make sure that people understand what the topic is about as they scan through this and try to understand where they can get help. Some cases like Alzheimer's disease and related dementias, it'll take you to a website that specializes in this. In other cases, it's material that we've gathered from a variety of organizations and try to organize it so that you can see local resources, statewide resources, as well as national and world resources. It's a challenge to keep this stuff current, and that's part of the collaboration. But just to make sure that this is at least an introduction so people can understand what it is about and what are the things they should be thinking about and how they can connect then to resources that will help them in all of these topics. We have collaborative efforts with a lot of different organizations throughout the state. Obviously, I mentioned the Alzheimer's disease and related dementias. Obviously, the Division of Aging Adult Services, the AAAs, gerontology programs at the various campuses throughout the state. Those organizations that are certifying students to have expertise in gerontology is a very important piece. Another area that's really important is being promoted right now is that we're very engaged in creating opportunities for merging arts and aging. We have a relationship with the Division of Aging Art Museum, and we have a particular group called the Utah Creative Arts Coalition. And you'll see information about this under the Kaleidoscope Festival that's being held this fall as an example of programs that partners put together to help bring the teaching artists of a variety of different skills into the communities to help older adults really experience, learn new skills, and have a very important social engagement opportunity. So the Kaleidoscope Festival is a very important part of that. We have Professional Education Center. We have the Media Center where we have blogs and you get connection to Facebook, the YouTube, and so on. The other thing that I want to point out, that my last comment here, is the importance of promoting lifelong learning. Now, again, some people know about some of these programs, but this is intended to help people connect to where they can learn about travel, educational, recreational. You've got the Osher Institute for the University of Utah, the Go Learn programs, other organizations that sponsor life enrichment opportunities like Next Avenue, Senior Planet, Dressler Detours, and so on. So these are all opportunities for people to really take advantage of those opportunities. I can't emphasize enough, again, that the journey can be challenging, but we want to make sure that everybody has an opportunity to explore while they're taking care of important needs, explore where those rich opportunities are. And we're happy at the Utah Commission on Aging to be a digital navigator to assist you. Thank you.
All right. Thank you, Nels, Rochelle, Amy, and Rob for your presentations. Okay, we're going to start with some questions. The first one I'm going to punt to Nels. Nels, the Division of Aging and Adult Services, how can people know about what they do? Where do they go? And what's available once they get there?
Awesome. Great question. There are several resources, but the one that I'm going to share here, if you go to our website, am I showing that?
Yes.
Okay. If you go to our website, which is daas.utah.gov, or if you're like me and just Google things, that's usually easiest for me. If I just put in Utah Division of Aging or Utah Senior Services, that'll come up first. This is our landing page. Obviously, one of the really critical issues that we focus on here at the division is adult protective services. And so we put front and center the opportunity to report abuse, neglect, exploitation, financial exploitation, front and center, just because that's often a hot button issue, and we want to be able to connect people to that very clearly and easily. But we, so we have this section here that talks about some of the main things we do. Obviously, again, protection, adult protective services. If you come into the services section, there's a little blurb about each of our programs and kind of what it does, and some other helpful links. You can look at all of our programs. And then critically, this locations quadrant here shows where our area agencies are across the state. So people can look by county and see our 12 area agencies on aging. For instance, if I click on San Juan County, it'll first bring up well, we've got the wrong one there. We've got Southeastern on the San Juan County. It'll give information on the area agency on aging, and we will fix that to make sure we're getting folks to Tammy's agency or Shauna's agency in the right place. But then it also lists the senior centers in those areas. That's often a great entryway into services and into questions that people may have about that area. So again, if you look at these, this is again the Mountain Land, which is Utah, Wasatch, and Summit counties. It'll list the senior centers as well as the area agency on aging. So that is a great way for people to connect. And then we have some other things. We have the centenarian celebration, where we honor with the governor who joins us for that event every year. We honor the folks in Utah who are 100 years old or older. Utah's most exclusive club is what Governor Herbert used to call it. In addition to those services, our APS work, you can also connect with our Office of Public Guardian, which is a newer addition a few years ago to the Division of Aging and Adult Services. So it's all right there, as well as phone numbers and important links. So that is the best spot to get an overview as well as to be able to connect to these other agencies that are providing services out there.
Thank you, Dale. And Nels, on the protection section, will you click on that real quick? Because it will answer part one of somebody's questions. Somebody in the chat had asked, is this recording going to be available for use? And yes, it will be available for use. It will be posted on the Utah Commission on Aging's website, and that's the utahaging.org that is in the chat. So you'll be able to find that. And then under the protection section as well, that Nels is going to be showing, there are some resources under the abuse, neglect, and exploitation resources section. There are flyers, handouts, pamphlets, both available in English and Spanish. There's also some PSA, some public service announcements that you can use. There's a training for law enforcement, training for financial institutions, a link to AARP's Bank Safe program. And a guide to assisting victims of fraud. So for those that are looking to train their agencies, there's multiple resources available on our website for you, and then also some information on our multidisciplinary teams. So thank you, Nels. I appreciate that. Nels, while you're still up, I'm going to punt one of these questions to you. It says, how much of these services are supported by federal grants? I think this is referring to the Area Agency on Aging Services, and what is the status of those grants?
That is a great question. That's a lot of action going on right now. All of the services we provide at the local level, so those services at senior centers and across the state with our area agencies on aging, they are a blend of state, federal, and local county dollars that are paying for those services. As you would guess, a big chunk of our services are paid for with federal dollars, particularly in nutrition and these other Older Americans Act programs, which are actually federal, they're in federal statute. There's a significant amount of federal investment in those. As of right now, there's been a lot of upheaval. That may be too dramatic. There's been a lot of changes afoot. The Administration for Community Living, where aging services were housed for many, many years, that agency has been dissolved within the Federal Department of Health and Human Services. And they have moved all of the aging services under the Administration for Children and Families. So taking more of a holistic approach from children up through senior populations. None of the programs or services that we've administered have been impacted by the changes going on. There was a lot of talk in April and May that of elimination of programs and different things. None of that came to pass in the bill that the U.S. House passed recently. The funding was level funded in that. Again, there are some proposals to move things around, but so far we haven't seen that. There's been a lot of discussion about changes to the Medicaid program and work requirements and cuts there. The Medicaid programs that serve older Utahns are not impacted by those work requirements, and so far the funding appears to be not impacted. There are lots of devils in the details, so there may be some other impacts there, but nothing that we can see so far that's significant. That said, obviously this has passed the House. It's now going to the Senate. And the Senate is feels very strongly that they have a different view of things than the House does. I had the opportunity to do some visits on Capitol Hill a month ago, and that was very clear as we talked to staffers from the House and staffers from the Senate that those two groups have very different opinions of where things should go from now. So. Again, I think there's been a lot of discussion, a lot of proposals that were thrown out. none of which seem to have really come to pass in the House version. But that said, there is still the Senate will tee up their version of this in the coming weeks. And then there will be a lot of wrangling back and forth between the House and the Senate to come up with something that will pass both of those groups. That said, as we met with staffers and policy advisors to Congress in DC, there is certainly not an appetite for doing damage to these programs, and the consensus was that these are important and worthwhile programs and good investments, and they anticipated that we wouldn't see a lot of impact. So again, it's early in that process, relatively speaking, and it is Washington, D.C. in 2025, so anything is possible. But as of right now, things feel fairly secure, and we will continue to monitor that.
Thank you, Nels. Rochelle and Amy, I'm going to punt the next two questions to you. The first one is, do all area agency on aging in the state have the same programs available? And if not, what are some of the differences, and how can people know what services are available in each area?
Thanks, Tracy. I'll go ahead and take a stab first, and then Amy can correct my answer. Just kidding. Okay, so for the most part, we do have similar services. I would encourage anyone who's curious about what services, like specifics, to reach out to their local area on agency. We do have minor nuances. For instance, here in Davis County, we host our AmeriCorps program, which is a retired senior volunteer program. We commonly call it RSVP. That's a program where we engage individuals who are 55 years and older to volunteer within our community, which is such an amazing program that helps support our senior services here in Davis County. Amy, from there, do you have anything to add?
Well, I think, like I was saying, as far as the programs and services, they are very specific to the area. Most AAAs do provide the same programs and services, but there are some, for instance, New Choices Waiver. Not every AAA provides New Choices Waiver. Veteran-directed care, not every AAA provides that veteran-directed care program, because those are separate contracts that different agencies contract with the AAA. So even if they don't provide the service, they'll know about it enough to refer them to the help that they need if you do contact your AAA and just ask about something specifically.
Thank you. And then as a follow-up to that question, how do the AAAs help people connect to community services when wait lists exist?
You want to go first, Amy?
I was just going to say, a lot of what we do is connecting people to resources. We're not able to do everything for everyone, but we do know the local areas, and we are able to connect people to those resources. So if it's a housing need, if it is, a question about some other, like employment or something like that, or Social Security, we have staff that are trained in our specific areas to be able to refer people to those resources locally.
Yeah, I was just going to add, I think each AAA probably has different relationships with their community partners, but relationships exist. And I think that is the key. In Davis County, we have, a platform where our community partners share resources so that we're aware of the resources specific in our area, similar to what Amy said. So even if it falls outside our purview, we're going to be able to provide that referral and assist them with where to go for that.
Thank you. More and more seniors are being pushed into conducting business, finding services, etc. through technology. Is there a potential to do computer basic skill, phone basic skill training that travels to locations where seniors are grouped?
I'll answer that. I know we work with an awesome agency called Tech Charities, and we were able to invite them to come into our senior centers and present to our different senior centers on their program where they offer low-cost laptops, tablets, and they do some basic education on use. And then we also, through our senior centers, offer beginner computer classes and advanced computer classes. And many of us also partner with like our local libraries where they offer different classes, or we may host someone from an outside agency to come in and provide those types of services with learning computer skills.
Yeah, Tracy, I know a lot of us also work with the Utah State University branch, which is the Technological Design and Technical Education Center, or the Utah Technical Assistance Program. And they have reached out to us about providing technical assistance in our centers as well. So I think, you know, similar to Amy, I think if there's an agency out there, we would absolutely love to partner with them. And I could probably speak to that throughout the whole state. I think any of our AAA areas would be more than willing to have those types of trainings within our senior centers.
And I know, Rob, with the Utah Commission on Aging, a lot of what you do is different types of education. I don't know if you want to speak to that as well.
I think, excuse me, I think you covered it well. And, you know, you mentioned Tech Charities. One of the things that the commission does, Tech Charities is part of the commission body by appointment, is to look for these opportunities and to co-promote how we engage each other to help each other. And it's, I think it's a great example you pointed out of how that could work. And I would just encourage, again, people who are looking for topic specialists, if you're not sure where to go, the commission can help find you experts to work with you and to talk to your groups.
Thank you. All right. I do not think there are any more questions in the chat that have not been answered. So I think we are going to go on to our next group of presenters. So we are, oh, we got one more. I work with a senior resident and they are not interested in senior centers. That was the wonder about travel, is if there's anywhere outside of the senior centers, maybe that they could go to out to get this education.
That's where I would suggest maybe looking at your local libraries or other, you know, universities in your area, technical colleges, different things.
Yeah, that's going to be a big suggestion.
If they don't want to go to the senior center, if they call the area agency on aging and they express that, they may be able to highlight different opportunities in the area outside the senior center.
And I'll add to that, that again, this is a good example that senior centers may attract 8 to 10% of our older adult population. And so there are a lot of people who are looking for other ways to engage. And one of those is, again, intended by the commission is to help point them to other places. Lifelong learning was an example. And there are multiple places in there that talk about organizations that allow for virtual engagement, in-person engagement, educational opportunities, as well as arts we talked about. So the Area Agency on Aging and the senior centers in particular do feel a really vital need, but it's a portion. And so we want to make sure that people have other places they can go, and would encourage them to explore some of these resources through navigating the utahaging.org to see what other opportunities are out there.
Thank you. All right, our next group of presenters is going to be Raven from the Alzheimer's Association, Alan from AARP, Patrick from Senior Blue Book, and Cassidy from 211. And again, if you have questions, please put them in the chat, and we will, after the 4 of them present, we will have a Q&A session. Raven, we are going to turn it over to you.
Okay, thank you for having me as part of the conference. I'm happy to be here and I'm learning a lot from all of you. I want to talk to you today about Alzheimer's Association resources, especially those for caregivers. I'm the program director for the Utah chapter, and my main focus is to make sure that we bring these resources to every community in the state of Utah. So we do this in different ways depending on the community. We often like to begin that process by listening in the community and finding out what people have to say about what's helping already, what opportunities they see and ideas, but also the needs and the barriers that they're facing. So our mission at the Alzheimer's Association is to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. So we approach this mission with different efforts. The effort that I'll focus on today is mostly our programs and services, our care and support effort. But these work in tandem along with our other efforts like funding research, advocacy, and development as well. A little check-in on the difference between dementia and Alzheimer's disease. So dementia is just an umbrella term used to describe a range of symptoms associated with cognitive impairment. We currently refer a lot to the dementia continuum because this now also includes mild cognitive impairment as well as mixed dementias. And then you can see the most common diseases causing dementia here. Alzheimer's disease being the most prevalent. This collection of symptoms, while it often is thought of as relating to memory, can also include behavioral, psychological, and other cognitive symptoms. It is due to biological changes in the brain. It is not a part of normal aging. So it's so important for us to know the cause of the dementia symptoms best as we possibly can to provide as best support as possible. We do put out a report every year on the facts and figures relating to the burden of Alzheimer's and dementia on folks in the United States. This relates to individuals, caregivers, our local government and national government, as well as the healthcare system. So if that's something you're interested in, you can go do some light reading. A few of those just to highlight today, just thinking about, how prevalent this is in our country. 1 in 3 older adults dies with Alzheimer's or another dementia. This kills more than breast cancer and prostate cancer combined. And something you don't see on here too is the impact that this has on caregivers. The caregiving for someone living with dementia can be incredibly impactful on the caregiver's health and well-being, including increasing risk for depression and other mental health issues, chronic diseases, and even premature death. So we know how important it is that we make sure people get support. It's both important for the person caring for them as well as the person with the diagnosis. So we have supports, and I'll go into some of that here in a moment. Something we want people to know about is that there is current treatment available for Alzheimer's disease. While there is no cure, there are treatments that can change disease progression. Because everyone experiences Alzheimer's differently, these treatments work in varying degrees and are not effective for everyone. However, there are options both for mitigating symptoms as well as slowing the progression of the disease. So we just encourage everyone to speak with providers if you are noticing symptoms of cognitive, behavioral, and other changes that might be dementia, because we know that there's hope for treatment early if it's caught early. Also, it can ease the burden for the caregiver and the person living with the disease if we can help treat some of those symptoms as well. Some other exciting news about reducing risk for dementias. So we know based on research that there are actually lifestyle changes that we can make at any point in our lives that can reduce our risk of cognitive decline. So you can see those here, the 10 healthy habits for your brain. And these apply to everyone, including if you have a genetic component to your risk. So living out these activities like continuing to challenge your mind, staying in school, these help us to continue to strengthen those connections in the brain. And, when you're learning new things, it even sends more blood up to the brain, interestingly enough. Eating right and getting good exercise, just like with most things, it is a great thing to do for reducing risk for dementia as well. And some things like getting good sleep and other things that we should be talking about with our healthcare providers, like managing our diabetes as well as our blood pressure and some others as well. So things that should be spreading the word about this in Utah communities to everyone so we can know, another reason to be motivated to do these great behaviors. So a little about our resources. The greatest one I really want to point you towards is our 24/7 helpline. Through the helpline, you can speak with dementia specialists, and you can also speak to dementia-trained clinicians, such as social workers that can help you navigate the challenges of supporting someone living with dementia. These resources are available for anyone, any member of the public. Providers sometimes can call these numbers if they're interested, caregivers, someone who's worried about their own symptoms. And these resources are available in over 200 languages, so they're incredibly available and accessible. Other resources that you can connect to by calling the helpline or going to our website include our online education. There's a lot of information there that you can watch on demand. You can also go to the website and search for a topic, and we have different publications you can find. And then you can also look for other tools and other community events and resources. One of the parts of the website I wanted to point you towards is the part specifically for caregiving. This part of the website is a great hub to go to start because, like I think I mentioned, it's a very big website with a lot of information. So this might be your best starting point to go for all the resources on caregiving. And that's alz.org/help-support/caregiving. One of the resources I also want to point you towards is our Empowered Caregiver series. It is such a difficult challenge to care for someone long-term, and we want you to feel as empowered as you possibly can and understand the journey you're about to embark on or to help you get more support while you're currently navigating that journey. Here's the 5 sessions that are part of this series. This is an education series that's available in person in communities or online. You might also be able to find a live session online as well as a recorded. So it really takes you through everything you would need to know from start to finish with planning and also for making sure that you're taking time for yourself, building that into the plan as well as what you need to do for someone else, but also how do you get support for you while you provide that support. And here's just a little snippet from that curriculum. Preparing for your role is so important, and remembering that you need to know all of the resources in the community that can support you. And that includes professionals as well as perhaps, faith community members and other family members and friends that care for you and care for the person you're caring for. I also wanted to mention dementia.utah.gov has a lot of other great resources. We love to send people here to help them find the other organizations in the state that provide caregiver support and other Alzheimer's disease and related dementia support. There are a lot of other resources as well, and it's so important to know about these, so please get comfortable navigating this website. A couple ways that you can connect with us. So a lot of people find it very fulfilling to give back to the community through sharing the information that I'm sharing with you or sharing components that you're passionate about. So perhaps you might be really excited to tell people about the helpline, or you might be really excited to share some of the education I was talking about. You can do that, and you can join our team if you would like. You might also just be comfortable sharing your story as an advocate and helping high-level decisions to happen in our state and in our country. There's a lot of ways you can get involved. A lot of people also find it very fulfilling to get out to the walks in the fall. So here's our walk dates for this year, and also some information on the longest day, which is in honor of the dementia caregiver, that every day is the longest day. And then here's my contact information. We'd love to have you reach out to our team. We can tailor our relationship with you to what you need and find out, a little more about you, a little bit about the opportunity you see and how we can help. Because as I said, we always start with listening. And I hope that we hear from you and that this is helpful. Thanks for letting me share.
Okay, I'll just jump right in then. I'm Alan Ormsby. I'm the state director for AARP here in Utah. It's really been a pleasure listening to all of these resources. We recently attended several of the WISE listening sessions, and it was really interesting that one of the key things that people talked about in those listening sessions was, I don't know where to turn. I don't know where to go. Help me understand where the resources are. So this has been a really great and very timely discussion about where those resources are offered. And I'll just echo that the area agencies on aging, there is no wrong door there. When you are struggling with something, the hardest thing as a caregiver anyway, is to find time to go and solve some of these problems. And so having a no wrong door policy like the area agencies on aging have is really, really good. I'm going to share with you some of AARP's resources. A lot of these are echoes of some of the other work that other people do, but we are thrilled to have the opportunity to serve 240,000 members in the state of Utah. But everything we do, everything is available to members and non-members alike. So you don't have to be a member of AARP. We obviously want you to be a member of AARP, but no matter what, our resources are available. They're free to everyone. And so I'm just going to walk through several large kind of topic areas that AARP offers. The first is I'm going to specifically talk about the stuff that's available in Utah. AARP in your community in Utah. This brochure will tell you all of the various things that we can share as far as topics. We are happy to come out to groups of about 20 or more and do any kind of education that you find is necessary. There's also this, if you've never used a QR code, QR codes are fabulous. You just hover over it with your camera. It'll bring up a kind of a yellow bar, and then you just click on that. This is all the resources that are available in Utah specifically through AARP. And of course, you can just, as Nell said, Google it. Everything that AARP offers is on one page. If you Google AARP Utah resources, it'll take you to a great web page that will kind of share all the things that are available to you. A lot of people are not technically savvy. That's okay too. You can call us. At the end, I will give you my phone number and my email address as well, so you can always do those things. I want to talk a little bit about advocacy. Some of the things that AARP is working on as far as advocacy is concerned. We're working on Social Security at the moment. I think everybody knows at the federal level that some very big budgetary changes are coming, and potentially those could impact Social Security, Medicare, and Medicaid. And so we're watching really carefully, and we will be advocating for a continued strength in all of those services and the things that people rely on most. To echo some of the things that Raven talked about, AARP has a tremendous library of caregiving services. One of my very favorite is this document here called Prepare to Care. Prepare to Care is just really a great document for ensuring that as you start your caregiving journey, you've got the resources you need. You think about the things that caregivers need to do. There's legal resources there. There's financial resources, things to think about, and opportunities for you as a caregiver to hopefully think things through at the beginning rather than at the end when things are a crisis. And along those same lines, AARP offers a family caregiver resource guide. This is specific to Utah. These are things that, if you open this up, you can see there's all the names of all the different agencies, a little description of what they do, and opportunities there that you can take advantage of with all those resources. Fraud Watch is another thing that AARP really cares a lot about. Fraud is what brought me to the aging world. My grandfather was defrauded out of a lot of money. And sadly, once those frauds take place, it's almost impossible to get that money back. And it's very difficult to prosecute the bad guys who steal from older adults. And so prevention is really the only thing that is guaranteed to help people. So AARP offers something called the Fraud Watch Network. I would Google that, and you can join the Fraud Watch Network. You can tell people on that network, here are the latest frauds, right down to the neighborhood level. You can say, hey, there's people in the neighborhood who are walking around telling people that their roofs are leaking or that there's a problem and that they are potential scammers. So you can see the latest scams. I think most of you have probably seen the more recent scams lately. You get a text message that says you owe a toll. The Utah DMV is going to come after you. We educate people and say, don't respond to those, block those. It's not real. So lots of opportunities for people to avoid fraud, because again, once frauds take place, you're never going to get that money back. So we educate people about that. And the last thing I want to kind of talk about is the AARP driver safety program and tax aid. So driver safety, we do over 1,000 classes, or we educate over 1,000 people per year at various classes. Senior centers are typically where we do this, but we also do them at libraries, community centers. So if you're interested in figuring out, are you safe to drive? Is the loved one that you're caring for, are they safe to drive? Could they be a better driver? You just got a brand new vehicle, and that brand new vehicle has technology that maybe you don't understand. There's a branch of what they do called CarFit, where they go through and educate people about the new technology in vehicles, how to take advantage of those safety features. So driver safety is just an incredibly great program for anybody who is struggling with their own driving or the person that they love. And as an added bonus, most of the time you can get a decent discount on your insurance through driver safety. Most of the insurers in Utah will give at least a 5%, and some give up to a 10% discount. And with insurance prices being what they are, that is no joke. Tax aid is a program that AARP offers through volunteers. Tax aid allows people to come in, bring their documents, bring their return, and a trained AARP volunteer will actually submit those returns for the person free of charge. Last year, we did about 6,000 returns in the state of Utah. We brought back about $5.5 million worth of returns to the state of Utah. That's real money that really does make a huge difference. So, those kinds of issues are huge. Let me end with just some specific AARP Utah kinds of things. So if you need to reach me, you can reach me at Ormsby, ORMSBY, at aarp.org. You're welcome to do that anytime. We really do care about these issues. We want people to be sure that they feel like they've got a voice. And so feel free to either email me, you can text me. I'll give you my phone number. It's 801-739-3816. And again, I'm happy to hear from you either by phone or by text. We are always looking for what are the advocacy issues that our members care about most. We have done a lot of work on the state tax on Social Security. That has luckily now been pushed up to very few people actually paying state income tax on their Social Security. We're going to keep fighting until we get that eliminated altogether, but it gets harder and harder. The higher the income that is actually affected by that, then people argue, well, it's only rich people who are getting impacted by that tax, and so it becomes a little more challenging. But it's something our members tell us about all the time that they care about. Property taxes are another one that our members have told us this is really important to them, and so those are the things we advocate for at the state legislature. So we're always interested in hearing what the big issues are that you're confronting. So feel free to reach out to us at any time. And I want to say thank you.
Okay, it is my turn to present here, and I'm working on getting everything set up and sharing the screen. I'm Patrick Trombley with the Seniors Blue Book and the Senior Expos. So just going to start off by saying it is, no matter who you work with, no matter what angle you come in with, finding these resources, whether it's with the Department of Health and Aging Protective Services, the AAA, AARP, any of these organizations that you connect with, they're going to be great about helping you connect to the next organization or find that person. If they can't help you, they were going to be great about helping you find that person that you need to find. So I'm going to start sharing screen here and okay. So to start off, we're going to talk about the Seniors Blue Book and kind of what it is essentially. You guys see my screen okay? So Seniors Blue Book is a comprehensive guide of state and local and government resources. So we work with government organizations, nonprofits, charitable organizations, and of course, businesses throughout the state of Utah that serve you and serve our community, serve your family members. We do a couple different versions of getting that resource guide together and putting it out to you. We do print books, we do about 120,000 books per year, and they're distributed about 1,800 different locations throughout the state. They're 100% like Smith's pharmacies, hospitals, clinics. Most of the big hospital systems, there's social workers, case managers are going to utilize them to give them out to patients as they're transitioning through. So the Seniors Blue Book, we also have seniorsbluebook.com, which is a website and a search resource that can help you guide through everything, whether it's in a map format, there's an event calendar and educational articles. So, in the book, the resources are laid out pretty completely here, and a lot of people do prefer the print versions over the digital, and some people just like to have that manual version. If you can't find one, just give us a call or email, and we'll send one out to you or drop one off. So the community resources are laid out pretty easily to find, and it gets more detail oriented. And then we get into things like help at home. This is where the Seniors Blue Book becomes really helpful, as it breaks down different categories here, where it actually breaks down areas, things that you or your family members, your parents may need, and it will help fit with different insurance levels, whether you're bilingual, whether you need a dog, a pet, or whether it takes veteran services. It breaks that down in the book as well as on the website. And I'll get into the website more in a little bit here. So we do have different versions of senior housing and opportunities that are available there. And again, that grid listing helps pop everything into place and helps you get into whether it's an independent living, assisted livings, memory care, and skilled nursing. So on the website on seniorsbluebook.com, so there's a few things that we do, and we really work with all of these groups and agencies to help us have as complete information as possible and get this out to you guys. So that's like was mentioned earlier, our biggest goal here is to help get all of the resources out to people's hands and help them know it. So if you know anybody that needs these resources and everything, please share them with your friends, family member, your healthcare providers. Make sure that they have all the information to help connect people. So on seniorsbluebook.com, we do a search and compare senior living services. This is a great resource to actually put it all in there and actually compare what the few things that you need. So we do an events calendar. We have educational articles and educational videos as well as volunteer and job opportunities. So going a little bit more in depth into senior housing. So when you get onto the website, you can navigate it and it goes through, there's a local page. It is a national organization. We do run this locally from the grassroots here in your community. Senior housing area, it includes categories as assisted living, memory care, skilled nursing, independent living, affordable and subsidized housing, and other types of housing. And this is on the bottom here. This is actually you can select, if you push this button here that says compare when you're looking at the location, you can select 3 of them and do a comparison. This is a snapshot of just part of what you would get in comparison. And it would actually kind of go into more granular detail, just saying, okay, helping meet your needs, what types of insurance it covers, and whether like things like pets and locations so there's a lot of different opportunities, and getting that comparison ability is really important here to be able to track down something that will meet your specific needs or your family member specific needs really closely to you and directly in that community. So in the home health and hospice section, so this is another section, we got non-medical home care, home health, and we have hospice. So this breaks down, and there's also an opportunity to teach you about the different terminology and what these things mean, how they connect, and how you can connect them and use them with your family members and help them transition through the process. So, and that also in here we have resources and services. This is where a lot of our government agencies are going to be listed, and a lot of the programs that you're already hearing about are connected to. So this resource lists activities, business to business, community services, medical services, help at home, hospitals and clinics, legal and financial, Medicare, Medicaid, and insurance, and just products that are specific to seniors and things that would be helpful in activities of daily living, that nature. We got professional services, rehab and therapy, and specific ailment information, as well as staying healthy and support and help walking through this. So this is things that are available there. So here, and another thing that we do is we do a free events calendar, and this is free for anyone and everyone to use. A lot of organizations will post their events that are coming up, and so that way you can come on here and look at, okay, what's the current event going on, and we cover things like professional activities, we cover senior activities, continuing education, and national conference. So this is a great place to come in and find out what's going on next or what's in your neighborhood. The event calendars are free to use. You can create your own login and post events if you're doing this regularly, or we can just email us and we can help you out with that too. So and we do have an article library. So a lot of educational materials are gathered here. So some of these are local and some of them are national as well. So we do have a national group with the Seniors Blue Book that helps get these articles together and helps educate us and our community about all the different things that are important with seniors and their lives. So areas we cover is caregiving, definitions. So sometimes walking through the definition of what their different terminology means is a whole learning process all on itself, just to know what I have to talk about and what I'm looking for. Then we get into elder law, health at home, we have healthy aging, money resources, professional services, senior housing, articles by location, and info for professionals. So educational materials there for professionals as well. And then we do have a comprehensive video library too. Again, it covers all those same topics that we've just discussed in the other library. So there's different opportunities of just moving through the website and accessing a lot of this information. So it is a lot of information to take in, and it's not going to cover it in the snapshots that we're going through here. But we'll be walking through the website. If that's not enjoyable to you, like we can get you a print book. If that's not enjoyable to you, we'll help find you a different resource that is more easily digestible for you and connect you with one of our other amazing resources here that you've already heard from to help find what is the next step for you. So one of the other things, like on the website that we do have, there's a subsection here. As you scroll down a little bit, we have an Ask an Expert area, and you can go on here and order a book, or you can get a local newsletter sign up where you can be updated about local events and things going on. And one of the other things that we do as well is in the fall, we do in-person events to help connect you with all of the people you've heard from, a lot of the local businesses. We do health screening. So this is a great opportunity where you or your family members could come in, meet directly with the people providing the services, get a lot of health screenings all in one shot. So in one day, you can essentially see, save yourself months of work and gathering together and trying to find the right resources. We do our best to compile everybody together in these events. So we do them in Salt Lake, October 8th and 9th, Davis and Weber counties, October 22nd and 23rd, and in St. George. So again, those resources are there. And our goal as we work through all these things is really to help connect, seniors, caregivers, family members, your neighbors, connect you guys to the resources that are available to you. And there's so many different groups providing these resources. And our goal is to really help you just find those out as in the best way that fits you and to help guide you through the process as much as possible. So, and that's, I'm gonna stop sharing there.
Okay, I will jump right into it. Let me start sharing my screen. Perfect. Okay. My name is Cassidy Bybee. I work at 211 Utah. We house over 3,000 different organizations within our online database with over 10,000 services. We know that can be a lot to absorb, and we are working. In the past, we have been more noted as an information and referral database where you would call 211 and then you would get access to resources that you may be needing within your area. We have recently gone through a reorganization, which we took a really hard look at the data and what the needs of the community were, and we decided to move more towards a service navigation approach. So what that would mean is that when someone calls into 211, instead of just giving them the information for the resource that's available to them, our service navigators, they start to work through that process with them. They are calling the direct resources so that they can get access. They are starting to help with online applications. I know it can be very daunting with a lot of these different organizations. I know that in quite a few different spaces, we've talked about just like waiting lists, trying to wait to get into the call queue. We are trying to hone in to really help our community members get access to a lot of those resources. We do warm transfers. There is a lot of follow-up data that's being done where once we do give out those resources, our service navigation team, they are following up with the clients, usually about a week or so later, making sure that they got the access that they needed, or they have started those application processes. And if they've started those application processes, then they will schedule those follow-ups for usually about the time frame of whatever application they've done. We've done the research to try and have all of that information at the ready, just so that we know when these individuals are supposed to get off of a wait list or their application should be pushed through by, just so that we're making sure we close the loop and people are actually getting access to those resources that we are giving out. We also try and look at alternatives if a resource didn't pan out, if maybe they applied and they didn't qualify, then we'll go back and we'll start looking and doing that research to really get them the help that they need. So with all of this in mind and really honing in on what we're here for today, I did do some research on different statewide options that we might have that are relevant just for different services, as if someone were to call and needed help right now and what that process would look like. I think that's been really helpful, especially with our reorganization. We are still figuring all of this out. We are trying to really hone in. We are trying to start adding case managers just to have a lot of those really direct contacts. We are starting to really hone in on our rural areas just to make sure that we can try and get individuals the help that they need across the whole entire state. I know that that is something that I think we all here will have issues with, and we get in those bumps in the road. But today we've looked at different statewide resources that we currently have, but we are just working to make our resource database even better, finding even more resources and seeing different ways that we can do that. So a big one that we would refer out to is the Adult Protective Services. This is if anyone needs help with any sort of abuse or neglect or anything that they think are happening. So usually we will have a general overview of our service. Our navigators know exactly, okay, I know if this person is in this situation, this is where they need to go. We have the eligibility already within our database so that we know, okay, this is how you qualify for the service. And then we need to know how we can connect them to this service. If there's a phone number to call, then our navigators will call with that individual. And if there's an application that needs to be filled out, they have started walking through individuals how to apply for those different resources. In this circumstance, if someone doesn't have access to a computer, if they don't have access to the things that they need to be able to report on it, our navigators have gone through different trainings with different avenues to be able to help that individual actually apply, and then they will follow up. We do have examples. So if Bailey was to call with concerns of her grandmother being abused in her current living situation, our service navigator would connect with the Adult Protective Services, and then that navigator would help Bailey work through all the different avenues. So she will connect her to Adult Protective Services either through a warm transfer, or she will help her apply online. And while talking to Bailey through this, we will also make any sort of other resources available if we find out that something else might be needed. But our service navigator would then follow up in a week and make sure that this situation was taken care of, check and make sure that her grandmother was able to get out of the situation she was in, or that the application has been filed, and then see if there's any other resources that we could connect her through. So this is one major one that we've got that's just available statewide. And then another one that we have quite a few referrals for is the Utah Legal Services for Elder Law. So this will represent clients who are seeking any sort of help with Social Security benefits, unemployment benefits, anything that they might need for this more vulnerable population. So we have all of our eligibilities listed out. So our service navigators are going to walk through this process with all of these different individuals and make sure that they qualify before they even go to the service. And then they can help them apply through the website. And this is just the method that we've been doing through our reorganization to really try and help people get access to all these resources that are out there, and just trying to overcome a lot of those barriers that we do have. But through this, we don't just have a phone system. We do also have our online resource. So if you go to 211utah.org, you'll be brought up to our website. And if you just enter whatever zip code you're in, it will bring in all of the resources that you can navigate through. It has it all separated out into housing, food, transportation, any sort of basic need that you might be needing. We do have a lot of general resources. Like I said, there's over 10,000 services in there, and I know that that can be a little daunting, but just know that you're not alone in any of this. If you are having issues with the website, please just dial 211. We are here to help. We do have a few different avenues to be able to go. We have an email available. We have a text you can call. We have an ongoing chat that is available for everyone in the community. And yeah, that's pretty much what I got. But here's my email if there are any of our partners who are on this call and you need help with any questions. There's my email and there's all of my information. But thank you, everyone.
All right. You want to give a big thanks to Raven, Alan, Patrick, and Cassidy for your presentations. And I am going to go because I've seen a bunch of questions pop in the chat. And I know one came in right when we were finishing up with the other group. So I'm going to go through the questions. So be prepared to be called on. Let's see, there was a follow-up question for you, Rob, on are you interacting with the U of U Health Systems Community Health Assessment currently underway?
Sorry, that question was for me.
Yep.
So repeat the assessment you're asking about.
Are you interacting with the U of U Health Systems Community Health Assessment underway that is currently underway?
I am not involved in that directly, no.
Okay.
The commission is not, I should say.
Okay. Nels, are you or anybody in DOS familiar with that one?
I'm not. I know there are a lot of efforts out there, but that's not one that we've been directly involved with that I'm aware of.
Okay. All right. Let's see. Someone also mentioned, Brianna mentioned that as far as technology, online classes for tech classes, they can go to seniorplanet.org and that information is in the chat. And then Jen K mentioned a lot of the area agency on aging also have caregiver support groups as well as dealing with dementia and the dementia dialogue classes. And that's true. And you can actually also call the Division of Aging because we have our dementia specialist, I know goes out and does a lot of those dementia dialogue classes. So lots of great resources there. I know Joe and Kristen from AARP put some resources in there. Joe is their policy advocate, and he said that you can contact him if you are interested in engaging with advocacy with AARP. Kristen put in some resources for AARP, and then I put in Alan's contact information. Raven put in a lot of contact information from Alzheimer's Association. So check your chat before we close out here and copy all those excellent links that are put in. For Patrick, could you consider giving the LCT Ombudsman contact information for the housing section, as we have a list of all the facilities in the county and we can give information on cases and facilities for people to consider which facility to choose? And I know Patrick has said yes, so that's a great contact information there. Can you mail clients and versions of the Senior Blue Book? And Patrick said yes, just contact him and his contact information is in the chat. And I think that was those couple different questions on that. So yes, just email Patrick for if you want printed copies of Senior Blue Book. What is the process to be listed as a resource, Cassidy? And she said you could reach out to her directly. So it looks like that question's been answered. Where are the 211 gaps in the state? So that one's for Cassidy.
Yep, I think that the majority of the gaps that we've really been facing are those rural areas, and there are still gaps. There are still gaps. We have partners in Utah County and in Northern Utah, but our gaps are really where our services are. You know, we can't create resources. We can't make those happen, but we can start looking and seeing if there are more things available than what have historically been able to be included in our database. I know that we are working towards changing how we're looking at that and just identifying the needs that aren't being met and trying to be a little bit more creative where we can look at those resources and where we need to look and see where they are being provided in those areas. And maybe we just don't know because it's not a traditional route that's ever been gone before. So I think that's where largely those gaps would be, and we are working towards it.
A follow-up, which I think you answered in the chat, so I'll just kind of read your response, Cassidy, but it says, can you help with heat applications, and is there also funding for lift rides? Yes, I believe as long as the caller is okay with the navigator's help, but I believe there may still be a little funding left for lift rides. Usually the rides each day are very limited, so call first thing.
And that goes in, Tracy, with our partnership with Lyft that we currently have to help individuals get to medical appointments. And I believe that they can schedule a ride at least once a week. But I think there's still a little bit of that funding left. And I know we do also share some funding up in Northern Utah as well. But we just stress people to call first thing in the morning because they go fast.
Yes, I bet they do. And also some of the area agency on aging have some opportunities for transportation as well. So that would be, make sure if it's for medical, contact your area agency on aging and see what their opportunities are. All right, are there any other questions? This is your time to ask all of our great resource providers that serve aging and older adults in the state. It's your chance to ask questions. I'll give it just a minute here. If not, this will be historic. Usually we go over and we will end early today. But on the behalf of NELS and the Division of Aging and Adult Services, we just want to thank you and for attending today to learn about resources, for caring about this topic, and for being passionate about ensuring that we can keep our older adults in Utah safe and help them get access to resources. And in particular, we want to thank our partners, again, the Utah Commission on Aging, AARP, Senior Expo, Alzheimer's Association, and Utah Area Agency on Aging. And then our speakers today, Rochelle and Amy, Rob, Raven, Alan, Patrick, and Cassidy, for taking time out of your day to share and help people learn where they can go to navigate some of the available resources. We want to thank everybody for today and hope you have a wonderful day.
Before you go, make sure you fill out the survey at the end. Thank you.
Yes. Yes, and the presentations and the recording will be available on utahaging.org's website.
Thank you, Tracy.
Thanks, Rob.